Hey everyone, welcome back to the channel. Today, we're walking through the story of David, a 59-year-old cyclist, university teacher, and now, a prostate cancer patient. But don't worry, this story is filled with information, stats, and smart decision-making. Let's break down David's diagnosis and what it means step by step. So here's the situation. David was living an active, healthy life. He went to his doctor for persistent lower back pain and, as part of checking things out, had a PSA test, a blood test used to screen for prostate cancer. His PSA was 4.2, just slightly above average for his age. That triggered further investigation, and here's where it got serious. David was diagnosed with prostate adenocarcinoma, a stage 2 tumor. That means the cancer is still confined to the prostate, hasn't reached the lymph nodes, and hasn't spread anywhere else. His Gleason score was 3+4, which classifies this as an intermediate risk cancer with some moderately aggressive features. And this wasn't a small find. David had high-volume disease on both sides of the prostate. 95 to 100% of the right-sided biopsy cores were full of cancer cells, and some showed signs of perineural invasion, which means the cancer is starting to track along the nerves. An MRI scan showed a 12 mm lesion in the right base of the prostate, and while it could be benign, there's a capsular bulge, which means if that spot is cancer, it could be sneaking out of the gland. But no lymph node or bone involvement. That's good news. PSA density, just 0.09, low, and generally reassuring. Now let's talk about David. He's 59, he runs 5 miles for fun, swims, cycles, and has 0 daily limitations. His performance status is 0, which means he's fully active. No major urinary or bowel issues, and he's still sexually active. Using NHS Prostate Predict stats, David has an 86% chance of living 10 years and 69% chance of making it to 15 years with just monitoring. But adding treatment? Those odds jump up to 90% and 78% respectively. That's a big difference. Cancer-related deaths at 10 years drop from 8 to 4, and at 15 years from 18 to just 9 with treatment. So what are his options? Surgery is one, but David has a short membranous urethra, which puts him at higher risk for urinary incontinence if he has a radical prostatectomy, and he'd really prefer a non-surgical approach. That leaves radiotherapy, or potentially brachytherapy. That's when tiny radioactive seeds are permanently placed inside the prostate. It's called low-dose rate brachytherapy, and David might be a great fit. He'll need some additional tests like urine flow studies, but if it's a go, he could avoid more intensive external treatments. If not, he's still eligible for external beam radiotherapy, possibly with 5 focused sessions and up to 6 months of hormone therapy. David's story reminds us that prostate cancer isn't always an emergency, but it is a moment to make informed choices. With the right treatment, there's a high chance of cure and of maintaining a high quality of life. Thanks for watching. If David's story taught you something, give it a like and hit subscribe for more real-world health journeys and breakdowns that make sense. Take care of your health, stay curious, and we'll see you in the next one.